Okay, right? Okay. So what is the use of this Merin's classification? What is the use of this Merin's classification? The Merin's classification is basically used to know the recall interval of an individual. Okay, so it is basically used to check out the recall interval duration of an individual. Okay, so normally we regularly have a very common duration of recall, like preferably 3 months is a very common recall in dentistry. Okay, so but basing upon the just a second. Okay, so basing upon the characteristics feature of an individual, okay, recall time of a particular individual will be varying. Okay, so by which the patients are being categorized into class A, class B, and class C. Okay, so this classification of patients basing upon their history, basing upon their clinical features into A, B, C is going to tell you that particular individual of this particular class has to be recalled after this particular time. So this is a main function of the recall visit. Okay, right? So you have different types of classes. Okay, for example, you have class A. So for class A, the recall is 6 months to 1 year. Okay, whereas for class B, the recall is 3 to 4 months. Okay, the recall is 3 to 4 months. Whereas coming to the class C, the recall is 1 to 3 months. Means as you move from A to B and you move from B to C, the severity of the case is improved. Okay, so whenever the case is more severe, the recall time will be dropped down. Okay, so you see A 3 months, 6 months to 1 year, B 3 to 4 months, and C 1 to 3 months. Clear? We'll see what are the clinical things, what are the information that we have. So in the first year, okay, in the first year, okay, that is a first year patient, okay, for routine therapy or the patient is having uneventful healing, the recall visit is going to be 3 months. Whereas for the first year patient, difficult case with compromised processes, you have furcation involvement, poor crown root ratio is there, questionable patient cooperation, then the recall visit will be 1 to 2 months. Okay, so you see, like for example, I'll have a glance about class B. Okay, so what is class B? Class B is the patient who is having poor oral hygiene, who is having heavy calculus formation, who is having systemic diseases that predisposes the periodontal breakdown. For example, the best systemic disease I can give you is diabetes. Okay, and the patient is having some pockets. You can see word, underline the word. The patient is having some pockets. Occlusal problems are there. Complicated processes is there. Orthodontic treatment is there. Recurrent dental caries is there. Some teeth are with less than 50% of bone support. The patient is a smoker, has a positive and genetic history, or more than 20% of pockets bleed on probing. So if the patient is having any of these clinical categories, he will be dropped into class B. Okay, right? So now I'll be jumping into class C. Class C, same. Poor oral hygiene is same. Heavy calculus formation is same. So there's no differentiation here. Systemic diseases predisposing to periodontal breakdown, same. Many pockets. Here you can see the difference is here you have some pockets. Okay. Here what you have? Here you have many pockets. Okay. That's a big difference. You have to make a note. Then occlusal problems are same. Complicated process is same. Recurrent dental caries is same. Very important point is periodontal surgery indicated, but not performed for medical, psychological, and financial reasons. They are financially may not be strong, so they have not went for the periodontal surgery. Many teeth with less than 50% of bone loss. Very important point to be noted. Here you have some teeth. Here you have many teeth. Okay. Next, conditions far advanced to improve the periodontal surgery. Smoking is common again. Positive patient history is common. Here you have more than 20% of the pockets on bleeding. Same here also you have more than 20% pockets on bleeding. Okay. So very important thing is class B and class C. How to differentiate class B and class C? Unique points you have to identify. So that unique points are going to tell you the patient is going to fall under this class, and indirectly they're going to ask you for this patient, what is the recall time? Clear, guys? Clear about this particular classification? Okay, right? Clear about this particular classification? Yeah, right. Okay, now check out your question number 1. Now check out your question number 1. Which of the following indicates the necessity of classifying a patient periodontal problems as class C? Which of the following might indicate the necessary to classify the patient's periodontal problems as class C? Okay, the answer is periodontal surgery indicated but not performed for some other reasons, right? The answer is B. Can you tell me what is the recall visit of this particular individual, this particular patient? What is the recall time for this particular patient? Yes, the recall time is 1 to 3 months. The recall time is 1 to 3 months. The recall time is 1 to 3 months. Very good. Okay, right. Okay, right. The next important thing is, like for every individual, like you see toppers of the college or toppers of a particular institute, or a toppers among you who topped the exam in the pro life. Okay, so everyone has a unique property why they are becoming topper. Okay, right. Everyone, like you see a particular hero, you like a particular mentor's class. Why you like, you have a reason. That unique quality is making you to stand out in the competition, or to stand out in the society, or to stand out when 15 or 20 people are there. Similarly, when I'm talking about infections also, every microorganism having some unique property of which they are outstandard. They are coming out and they are causing a particular disease or particular infection. Okay, so that problem, I mean that property of a microorganism to fight against the odds and to come out and stand unique when causing an infection is called as virulency. Okay, so it's called as virulency factor. Okay, very, very important. So I mean, like this is a main topic when I'm talking about microbiology, but as of now, we'll try to understand few important areas related to perio. Okay, so these are the virulency properties of an organisms. Means these organisms are going to do something which makes them unique. So what is the one? First one is endotoxins. Okay, so first one is endotoxins. Your endotoxin released by bacteria, because there are few bacteria which are going to contain lipopolysaccharides. LPS is lipopolysaccharides. Okay, bacteria which are having lipopolysaccharides in their wall, whenever they are dead, these lipopolysaccharides are going to release a toxin called as endotoxin. We'll learn about the differences of endo and exotoxin in your microbiology. Okay, so bacteria which are having lipopolysaccharides are going to release endotoxin. So endotoxin is very, very important in causing periodontal pathogen. Second one, there are few bacteria which are going to have enzymes. These enzymes will lysis the periodontium. For example, PDL. PDL is made up of collagen, right? Which type of collagen? PDL is made up of which type of collagen? What type of collagen fibers are very commonly seen in the case of PDL? Yes, one is correct. Any other? One and? Yes, it is 1 and 3. The type of collagen fibers that are present in the PDL are 1 and 3. So what enzyme is required to break this collagen? What enzyme is required to break this collagen? The enzyme that is required to break the collagen is collagenase. Means there are bacteria which are going to release this enzyme and lysis the PDL. That is about the bacterial enzymes. The second one is there are few bacteria which are going to release ammonia, which are going to release H2S, which are going to release fatty acids. They also can act as virulence. And there are microorganisms which invades and they are going to cause tissue damage. Or sometimes you have fibriae, which is the organ of attachment, okay? Or you have few bacterial DNA, which has virulency factor, okay, right? So these are the different types of virulency factors that you have to make a note when I'm talking about perio. When they're talking about perio. Similarly, this is a table that is very, very important. Pathogen recognition receptor, that is PRR. PRR, okay, which means split it into LTR2, TLR4, and TLR9, okay, which are correspondent to this particular molecular pathogen, okay, means your TLR2 is present in fibriae, is present in lipoproteins, okay, okay, whereas, I mean, this is very, very important, okay, so whereas your 9 is present in DNA, okay, so this table is also very, very important, particularly for the people who is preparing for INICET, okay, so this is an SR-ship related table. If you want, you can make a note of it, okay, right? So check out your question number 2. Which key bacterial endotoxin is associated with periodontal disease? Okay, is associated with periodontal disease? Yes, the answer is LPS, lipopolysaccharide. The answer is LPS, lipopolysaccharide. Then comes, we'll try to learn few important lines related to the pregnancy gingivitis. Okay, so before going into that, we'll try to learn few important areas of gingiva. Okay, so when I'm talking about gingivitis, color change in the color is very, very important clinical sign of gingival disease. What is the normal color of gingiva? The normal color of gingiva is coral pink. Why it is coral pink is, it is being produced by the tissue vascularity and modified by the overlining epithelial layers. The gingiva become red. The gingiva become red when vascularization increases or the degree of keratinization decreases or disappears. Okay, so these are the important points that you have to make a note. Okay, when I'm talking about mouth breathing, what is the location where the gingivitis can be seen in mouth breathers? Any idea? The anatomical location in the oral cavity where you can see marginal gingivitis in mouth breathers is maxillary anteriors. And if you see the descriptive part from the textbook, the affected gingiva typically appears red, shiny, edematous. And it is mainly related to the surface dehydration caused by the mouth breathing. Okay, so this is how the gingiva looks in the case of mouth breathers. And when I'm talking about any sort of gingivitis, what is the etiology for gingivitis? So what is the etiology for gingivitis? Yes, the etiology for gingivitis is dental plaque. So etiology is always the dental plaque, but maybe the other features like hormones, sometimes in the case of puberty, in the case of pregnancy, they are going to act as a contributing or aggravating factors. Okay, right? Okay. So when I'm talking about pregnancy gingivitis, the etiology for occurrence of pregnancy gingivitis, what is your answer? The primary etiology for occurrence of pregnancy gingivitis. The primary etiology for occurrence of pregnancy gingivitis is dental plaque. Is dental plaque. Whereas your hormonal changes are going to contribute it. Okay, because whenever you have whenever the pregnancy is there, so in pregnancy normally there will be increasing in the progesterone and estrogen levels. So what is the future of progesterone and estrogen levels on your gingival tissue is, whenever there is an increasing in progesterone and estrogen levels, your gingival tissue vascular permeability will be increased. So whenever your vascular permeability is increased, Okay, so the swelling, the edema in gingiva will be more. Okay, right? So what happens in pregnancy gingivitis is plaque is going to cause gingivitis, whereas the permeability of your vascular supply will be improved with the help of progesterone and estrogen. Okay, and by which it is going to act as an aggravating factor in causing gingivitis. So tell me, what is the organism which is predominantly seen in pregnancy gingivitis patient? What is the organism which is predominantly seen in pregnancy gingivitis patient? Yes, it is P. intermedia. Okay, it is P. intermedia, which is very, very frequently identified in the pregnant woman. So anyway, let's check out the question number 3. What hormonal changes contributes to aggravation of gingivitis during the pregnancy? In the pregnancy, increasing in the estrogen and progesterone levels. Very good. The answer is C. Which microorganism is noted to increase significantly during the pregnancy? Which microorganism is find significantly to increase the in the pregnant woman during pregnancy gingivitis is P. intermedia. Answer is C. What changes occurs in subgingival flora as a pregnancy progresses? As pregnancy progresses, what is going to happen to the microflora subgingival is they shift to more anaerobic flora. They shift to more anaerobic flora. Okay. You see, like when I'm talking about metal poisonings, you see like many metal poisonings are there. So most of the metal poisonings, they are going to show oral signs also. Okay. Particularly, they show some gingival line. Okay. So that is about your next one. Okay. You can see here a noted blackish discoloration is seen here. You can see, can you appreciate that? Okay. Can you see here? You can see a gingival line is blackish gingival line is there along the margin. Okay. So this is, I mean, like they are going to give you multiple things. Okay. So this is one of the one of the clinical photograph taken from your Karanza. That is about your bismuth poisoning, which is leading to a blackish line on the gingiva of the patient. Similarly, you have one more thing. You have a restoration, okay, where you can see the discoloration. The discoloration of gingiva is there, okay. A discoloration of gingiva is there. The next comes is a little about. Have you seen these water jets and all these devices nowadays? Very familiar, common, used by most of the people. Have you seen this? Now this is the biggest commercial market. It has a very big commercial market. So we'll try to learn a little bit about this. Okay. So these are devices which are going to irrigate water with high pressure. Okay. By which the entire area can be cleaned properly. Okay. So now these systems are available as two different forms. One is power driven. Second one is non-power driven. Power driven is something where you will have a battery, okay, or you will be charging it like your phone. The second one is non-power driven is you are going to directly connect the outlet to the regular water flow tap, whatever you have. That is the main difference. What is the use of power driven is going to produce the water or the irrigant in an intermediate or in a pulsating jet of fluid, okay, with lots of power. So the cleaning can be more. Whereas you see non-power driven, they are attached to the water outlet that is available in your home. That is basically, it is attached to the household water supply. Simple difference, just the basics. Then the very important aspect here that you have to make a note is oral irrigator. So what is the other name of this oral irrigator, which is most commonly used is dental water jet. Dental water jet. So where do you use this dental water jet? You use this dental water jet in the patients or the population where the periodontal maintenance has to be done. Gingivitis, diabetic patient, because diabetic patients are more prone to periodontal breakdown. Okay. So what is the unique thing that you see in diabetic patient is one of the most important complication coming to the oral cavity of a diabetic patient is periodontitis. And there is one more question about this diabetic patient about the periodontal multiple periodontal abscess. Multiple periodontal abscess can be seen in the diabetic individual, or whenever you have orthodontic appliances, crowns and implants where the oral has to be maintained, you are going to use this dental water jet. So when I'm talking about this dental water jet, okay, one more important point to be noted about this dental water jet is about this. Okay, so whenever you have a 3-second treatment of pulsating water, that is about 1.2 liters per minute, 1.2 liter per minute, with a medium pressure of 70 psi, there is 99.99% of plaque biofilm that is being removed from that area. Not only this, this is also used as a to remove the tonsil stones. This can also be used to treat the cancer source, and this can also be used to for different other purposes. Okay, right? But the most frequently repeated question is the zones that are formed whenever your dental water jet is acting. Okay, so the dental water jet is acting. So here you check it off. The diagram is very, very important. Hope you can see. So whenever you're hitting that area is called as impact zone. The surrounding area where the water is flushing is called as flush zone. Okay, right? Area where it is hitting is called as impact zone. Area where it is flushing is called as flush zone. So that is a very, very important concept. So what is going to happen? It creates two zones by the fluid movement called as hydrokinetic action. One is called as impact zone. That is the initial zone of contact. The second one is flushing zone. Clear? So that is your question number 7. What are the two zones in the water formed while water irrigation devices are used? One is impact zone is the initial zone, and second one is flushing zone. So when I'm talking about this, there is one more very, very important concept is about the fluid depth penetration. Means whenever you brush, the fluid depth penetration will be something. Whenever you rinse, whenever you floss, so everything has a fluid depth penetration by which the cleaning of biofilm takes place. Okay, so if you check out the fluid penetration depth for toothbrushing technique, or for toothbrush, it will be 1 to 2 millimeters only. For rinsing, it will be 2 millimeters. For flossing, it will be 3 millimeters. And for dental water jet, it is too heavy, 6 millimeters. Just 6. This can ask you the sequence. So what is the fluid depth penetration? Arrange the following in the sequence. Highest is for dental water jet, followed by floss, followed by rinsing, followed by toothbrush. Okay. So this concept of fluid penetration depth is again a very, very important concept. Then these are like very common things. What are the benefits of home water irrigation? It removes the biofilm. Once it removes the biofilm, it can minimize the gingivitis. Yes, because biofilm is the reason for occurrence of gingivitis. The most common feature that is seen in gingivitis is bleeding. So it decreases the bleeding. Gingivitis is basically due to inflammatory mediators. It decreases the inflammatory mediators. Gingivitis in the future can lead to periodontitis. It reduces the periodontal pathogens. There's nothing too heavy to learn in this particular lines. Okay, but indications for the recommendation of oral irrigation already discussed. That is periodontal maintenance, patients who are not comfortable with floss, patients who need special needs, that is implants, diabetes, ortho appliances, prosthetics, bridge work, crowns, implants, whatever it is. Okay, all the prosthetic works. So now what are the solutions that are used? Normally, anyone using this? Long back, I used to use this, but now. So normally we are more comfortable using water. Okay. So water is highly effective and readily available. Or sometimes we dilute the chlorohexidine and we are going to use it with the water. So other irrigations are chlorohexidine. So tell me, what is the percentage of chlorohexidine that is available in the mouthwash? percentage of chlorhexidine that is regularly used in the mouthwash is 0.12%. If you don't find 0.12, then you can go for 0.2%. Can you tell me what is the percentage of chlorhex used in endodontic irrigation? Percentage of chlorhex used in endodontic irrigation is 0 to 0.2, that is 2%. Similarly, you can use powdered iodine with a ratio of 1:9 because this is going to be a bacteriostatic. You can use water. You can use stannous fluoride, 1:1. Reason of using stannous fluoride is, where do you use stannous fluoride? Stannous fluoride is fluoride, right? So it helps in decreasing the dental caries, one, and it helps in decreasing the hypersensitivity. Dentinal hypersensitivity is going to decrease. Okay. You can use tetracycline. You can use Listerine. Okay. You can use Listerine also. Can anyone tell me what are the two drugs which are available, which are available in GCF, which can be observed in GCF? Drugs. What are the two drugs which are available in GCF? Yes, tetracycline, right? Any other? Yes, tetracycline and metronidazole. Very good. Tetracycline and metronidazole. Very good. Okay, now check out this. Water irrigation devices has been shown to. Water irrigation devices has been shown to. Now, the point here is prevent the calculus formation. No, it cannot occur. Okay. And the second one is disinfection of the pocket up to 12 hours. No. It eliminates the plaque. No. Elimination of plaque can be done by brushing technique. Okay. It can be done by brushing technique. Okay. So the answer for this question is B. The answer for this question is B. Okay. Next one, you check it off. Question number 6, function of water irrigation devices. Function of water irrigation devices. Question number 6, function of water irrigation devices. Yes, the answer is D. Question number 7 is already done. Two zones in the water irrigation devices are impact zone and flush zone. Question number 8, bacterial endotoxin associated with periodontal diseases, LPS, lipopolysaccharide. So please write down the ADA specification number of ADA specifications of your toothbrush. ADA specifications of your toothbrush. 2 marks question for you in the final year. Very important for the exam. So the specifications are, the length of the brush is going to be 1 to 1.25 inches. Width is going to be 5 by 16 or to 3 by 8 inches. Number of rows are 2 to 4. Number of tufts per each row is 5 to 12. And if they're asking the surface area is around like 25.4 to 31.6 millimeters. Question number 10, ADA specification number of toothbrushes. Normal toothbrush, what is ADA specification number? Normal toothbrush, what is ADA specification number? Normal toothbrush, what is the ADA specification number?